Yeah, thank you. Thank you for the opportunity. Thank you for coming to our college. Uh, Given the diversity and the history of our college, uh, inherently we have quite a bit of contact with folks and educational facilities around the world, and Africa is no exception. We have already started cooperating with African universities and African leaders to try to expand our program offerings and cooperations and affiliations and partnerships with not just African countries, but also Middle Eastern countries, and really where we could share our expertise and be able to also educate uh, potential students and future scientists from all around. Well, I think it's good for humanity. I think it's something that is our responsibility as educators to do. I don't think we should, by any means, solely focus our education on a particular area or areas. I think we should be worldwide. I think that with the challenges of drug availability, new developments, additional knowledge, etc. This is an absolutely perfect time for the world to really come together for the betterment of humanity. And this is really just one effort in that process. Absolutely, absolutely. I think we are interested in setting a strong foothold in Africa. We see that as the next frontier. We really do, and I think to provide that opportunity for the entire continent would absolutely be aligned with your vision.
Thank you very much.
Yeah, thank you. Thanks for having me. Okay, bye bye.
So my name is Jackie Noved. I'm the Dean of Students for the College of Pharmacy. And one of the things I love the most about our college is how diverse it is. We really have students from 6 of the 7 continents. We don't have anybody from Antarctica, but we have people from Africa, Asia, Europe, everywhere, Australia. And it is a wonderful, diverse community with various religions, many ethnic groups, and we have student organizations to support that. We have the Middle Eastern Pharmacists Association, we have a Coptic Christians Association, the Muslim Pharmacists Association, Muslim Students Association. We have holiday celebrations for Eid and Holi with the Hindu students and many, many different holiday celebrations. And our students are out educating the community. We have events at various houses of worship, at mosques, at churches, to teach people about blood pressure monitoring, diabetes management, vaccinations, especially around the flu season time. And now with COVID, we are out educating communities about the COVID vaccine. So it is wonderful to have this diverse group of students reaching their communities all over New York. Absolutely. So many of our students, while they're in school, work as pharmacy technicians or interns. After the first year of pharmacy school, you can become a pharmacy intern, which gives you a bit more responsibility at either a community or hospital pharmacy. So in early stages of the pandemic, our students were actively working in ICUs and hospitals and community pharmacies throughout the city. And they were the ones preparing IVs to sedate patients who needed ventilation. And they were the ones filling prescriptions for people to help them manage their chronic diseases during this pandemic. And so our students were out on the front lines. One of the most satisfying things I've ever seen is students sending me photos of themselves vaccinating their parents, vaccinating their grandparents. Um, I still get goosebumps to think about it. It was just wonderful to see that happening. So our students are out doing vaccine clinics. They are immunizers, so they are able to immunize. They are also the ones preparing the vaccine for others to immunize. So hundreds of vaccines a day. So I will say I'm a mom, and I understand how scary it is to send your child so far away. Um, I'm here. We are here to take care of them. We are here not just for their academic needs, but for their social, emotional, mental health needs as well. Any student who is having any sort of trouble comes to my office, and we are here to take care of them uh, when you're far away. So they will be in good hands.
Thank you very much.
My pleasure. Thank you.
I think that bridge is exactly the best way to describe it is It's a gateway to connect students from this school and even educators in this school with intellectuals abroad. And we can definitely make note of remarkable intellectual achievements that have been done on the front of Egypt and different universities within Egypt, Cairo being one of the pinnacle ones. And I think it's encouraging to be able to see what others have aspired to create and to actually accomplish, and for students on this front to be able to learn from that and take advice and take guidance and also expand their own knowledge on the subject. So no matter the setting, no matter whether it's pharmacy studies or any other study for that matter, it's definitely integral to their growth and their intellectual development. And I don't see any type of way where they wouldn't benefit in the most possible.
احنا كطلبة هنا بنكون حوالي 10 ل 15% من الطلبة في لونج ايلاند يونيفرسيتي. احنا هنا عندنا طلبة كتير بنشتغل في صيدليات، اذا كان صيدلية في المستشفى او صيدلية صغيرة، واحنا منها بنتعلم كتير عن الادوية، وبنقدر ان احنا نساعد العيانين والبيشنتس المصريين والعرب اللي بيجولنا عند الصيدلية.
My name is Ahmed, and I'm a student here at Long Island University, Brooklyn, New York. As my colleagues were practicing on IVs upstairs, I'm currently a pediatric pharmacy intern here in New York. During the COVID times, I've performed various tasks in the IV room that has helped me help pediatric patients and adult patients in the clinical setting, and has been very beneficial just to learn here from the program at Long Island University.
As current Egyptian American students in LIU, there's a very large community, and in which that is very beneficial for us to network and work together. There's many organizations that have already helped to reach out to the community. So as students, we are currently working in pharmacies, in hospitals, and in many different settings to be able to reach out to our communities. So just looking at our area, there's in New York and New Jersey, there's a multitude, an immense amount of pharmacies that serve the Middle Eastern community, and there's an ample amount of students that do work in those communities. So they're able to see the patients right on face to face and see the impact straight away. Even through other organizations like Middle Eastern Pharmacists Association and American Pharmacists Association, we go out to communities and we serve Middle Eastern communities and different communities and speak to the patient about their medications and communicate what we currently learn in school to help those areas understand their medications and help to take better care of their health.
ريم، أنا عايزك تحكي لي عن الكلية هنا والتجربة بتاعتك مع الاكسبيرينس بتاعك مع الكلية هنا. لو تقدري بالعربي جود، أوكي. مش بالعربي جود، ما فيش مشكلة. في ريلاكس، كلمة عربي كويس. احكي لي عن التجربة بتاعتك مع الكلية هنا وانت دلوقتي جراديوت واتخرجتي ما شاء الله، وبعدين الكلية جابتك تشتغلي معاهم هنا تاني. طب قولي لي انت ايه الستوري بتاعتك مع الكلية؟
شكرا خالص ان تخلوني اكون موجودة هنا النهاردة. عايزة بس اقول ان throughout my years at LIU, I've been able to really integrate myself in different opportunities to work with students and collaborators through extracurricular activities. And of those is the Middle Eastern Pharmacists Association, so getting to work with other Middle Eastern students. Throughout my years, I've definitely built a reputation for myself and gotten acquainted with faculty, with students, and e-board members. And upon graduating, I actually had the opportunity to work in retail on the front lines of COVID for a little over a year, getting over 180 vaccinations every single day to patients and helping them with their medications. After that, I actually had someone reach out to me from LIU saying, we'd be interested in having you apply for a postdoctoral fellowship position. And one thing led to another. I applied, and here I am back at LIU as a full-time administrator, working as a postdoctoral fellow in health analytics and AI. which is an incredible field, and now I'm able to be the co-advisor for the Middle Eastern Pharmacists Association, helping these students learn more about health analytics and the opportunities that arise. I think most importantly, it's important to show that people of a Middle Eastern background are able to really flourish in this field and have a great impact on patients of all backgrounds, and again, really advancing the pharmacy profession.
ريم، يمكن الاكسبيرينس بتاعك دلوقتي ما شاء الله، شايف انت بدأتي يعني جود ستيب ان انت تبقي في الإدارة هنا في الكلية. يعني انا عايز تقولي ايه للبنات الجداد اللي هم لسه اليانج، اللي هم في الهاي سكول وداخلين كليات، بتديهم ادفايس ايه؟ what type of advice you give them?
The biggest piece of advice is to talk to someone. So whether it's a friend or whether it's someone through the school that you're not too familiar with, just reach out, ask questions. No matter what, a lot of people will tell you that pharmacy school is hard, that LIU has rigorous classes, but the bottom line is it's always challenging until you get more comfortable with it. So it's important to do your best, do your due diligence, reach out and get educated. And from there, it's really the support of your family members, your friends, your colleagues that you'll come to meet throughout your time at LIU that'll really help you cross that finish line. And before you know it, they're announcing you as having a doctorate in pharmacy.
Thank you very much.
Thank you so much for having me.